Welcome to a Shot in the Arm podcast, and a particular thank you for joining us on this last live stream that's been taking place now that AIDS 2020 is over and HIV 2020 is starting its monthly events. Well, I don't know about you, but I've been exhausted sitting in front of the screen trying to navigate my way around the conference. And so I hope today you will join us for a cocktail or whatever it is that you happen to be drinking. And we're going to look back at what a crazy week this has been. And, you know, I can't think of a better person to share that cocktail with than the fantastic Sara Anderson, who is the Executive Director of the Bay Area Global Health Alliance. Sara, welcome to a Shot in the Arm podcast, finally.
Ben, it's wonderful to be here with you. Thank you.
So tell us a bit about the Bay Area Global Health Alliance. What does it do?
Oh, well, thank you for asking. You know, it was formed, and this is its inaugural year, and it was formed really to connect and mobilize the unique talent pool and diverse expertise we have here in the Bay Area. We really wanted to maximize our region's impact on global health. And we're coming together. Our members are quite diverse, and we have world-class academic institutions here in the Bay Area, and they're all part of the Alliance. We have lots of NGOs and experienced nonprofits who are caring for the world's most vulnerable populations. And we also have tech here. The most innovative tech companies and biotech and pharmaceutical companies have all kind of joined together. And I think what we've done is we really have a dedication to working together for innovation and equity. And that's what unites us all. We're here because we believe in global health equity, and we believe that innovation is one way to get there. We also believe that, you know, we can't do this alone, and we have to get out of our silos and kind of bring our different sectors together to kind of find the solutions to a lot of the challenges we face today. And
you also have a fantastic grandfather clock that chimed Big Ben. No, I felt quite at home. It was wonderful. So Sara, what's your background? How did you get into this?
I started my career in working in politics and policy work in Washington, D.C. I worked on Capitol Hill and worked for many campaigns. And then since then, I moved to mainly the NGO field, but nonprofits that were working in health and other NGOs basically going from cause to cause. So I have worked in international security, trying to bring partnerships and communications to different issues, to injuries, to working on the war in Sudan when that was happening in the 90s, to the North Korea famine, to working on the global surgery movement and making surgery kind of part of universal health coverage. In that movement in the last 5 years has taken a great deal of my time. So I'm thrilled to be here working with so many different wonderful people and board members who have formed this alliance and decided to come together to really make a difference in the world.
Well, that breadth of experience, I think, is going to be invaluable as we're all having to join the dots, particularly in this new age of pandemic literacy. So first question, AIDS 2020, what did we learn? What really stuck out for you?
Oh, it was really an interesting conference. It was interesting to have it all be virtual. And when, you know, you usually go to those things for the networking and everything, but the science was really, really interesting. I also heard so much about the disparities that we've been hearing about in this country and elsewhere. And really how the COVID-19, the pandemic, is having such a serious impact on, you know, the world's most vulnerable communities worldwide. And it threatens progress not only on HIV, but on TB, malaria, vaccinations, and so many other areas of health. It was interesting to hear. It was really wonderful to hear so many activists and people coming together who are still so committed to HIV and realizing that we all have to come together to move the needle. It was for me, it was really interesting how the backdrop of this, and maybe you have some other thoughts there, but as the world set a record for the most new virus cases this week, and then the US started its withdrawal from the World Health Organization, and then we have the backdrop of all the structural racism as a public health crisis that's been brought to bear, and has really surfaced as a movement, which is really inspiring to see that maybe some of these issues will finally get addressed. So it was interesting, and it was interesting to kind of have that backdrop with the theme being about resilience.
Yeah, I was sort of at a first glance really shocked to see from the UN AIDS report. They issue a global report every 2 years at these conferences, and it bothered me a lot that not a lot has changed, that we're still having the same levels of HIV infection, and they really haven't changed over the last decade. An organization that we both work with, Friends of the Global Fight, Friends of the Global Fight. He's going to kill me for that. But Chris Collins was on this live stream at the start of the week, and he noted the direct number of deaths that are going to be caused precisely because of COVID. And it would be great if we could just get a clip of that now.
We're very concerned about COVID in itself, but also the potential damage that COVID could do to the AIDS, TB, and malaria responses. Really could potentially double mortality in those three diseases over the coming year.
Hearing it, hopefully the technical bugs will come back, but he was pointing out that, we are going to see about 500,000 additional HIV-related deaths this year because of COVID. And it really struck me and really perturbed me in a subsequent conversation I had with former colleagues in Zimbabwe who have been at the forefront of trying to really manage an epidemic when major funders haven't supported and haven't been part of them. And I had a chat with one of the leads of an organization that had its roots in the Bay Area, the Pangaea Zimbabwe AIDS Trust, Chris Marungu. And I don't know whether we can go to that clip and whether that clip's going to work. Should we try?
We have seen a progressive increase in the number of COVID cases, and I'm definitely worried about not just the impact of COVID in general, but also on the progress that we have made in terms of the HIV response in the country. We have just gone over 600 cases in country. But most of the cases are imported. So, we definitely need to see an improvement in terms of COVID testing coverage. It's definitely high.
So that was Joseph Marungu, and talking about the crisis in the difficulties in Zimbabwe.
Yeah. There's been so many setbacks by decades, and thinking of all the investments that have been made in these diseases. And, it is wonderful that we did make the investments we have in health system strengthening with HIV and with other diseases, because imagine what it would be if we hadn't even done that. So Ben, I just wanted to turn it back to you. You've been in these conferences for years, and what did you think?
Yes, I've been in these conferences for hundreds of years. And I was reminded that the very first conference I went to was the first Amsterdam conference, brought over by a British activist, and that we delivered an empty coffin to the to what I suppose would now be considered the embassy of the United Kingdom to the Netherlands. I think what I really learned this time round is, COVID forced on us a virtual conference. But the other really big whammy of this time, this era, is as a result of the murder of George Floyd, a revival of the Black Lives Matter movement. And I had a conversation with, I think, one of the next generation of the major AIDS leaders in this field, Ace Robinson, and it was a very direct, very painful conversation for me to have, to look at my own innate racism, and he had some incredible things to say about racism that exists, whether we realize it or not, in our own AIDS movement. And again, I wonder if we can go to the clip to see that.
Dealing with all the difficulties and passing from HIV-related illnesses. So I know we're looking at, when we speak about that 67% of people in HIV leadership in the US being white individuals, although white individuals only make up approximately 20-25% of the living cases in the United States. We know that that is all the parts of the systemic pieces that we must address. Who is sitting in the boardrooms, who's going to choose the CEO, and then the CEO is going to choose their senior team. Because one thing that one of my colleagues said, which was so telling, Black people will always be the decorations for an organization. They will never be the structure that's going to keep the building up.
And Sara, I know this has been something that you've been very, very passionate about in the work for the Bay Area Alliance. Tackling structural racism. How did you feel when you saw some of the commentary coming out of the conference, and particularly things like that very strong presentation from Greg Millett from AMFAR on the disproportionate effect of HIV and the disproportionate effect of COVID on the African American community here?
I guess the first thing, as far as what I feel, is shame that it shouldn't happen. But I also am pleased that the conversations are happening. I'm pleased that people are listening. Just like you said, that we can look at our own part of it, and that we can make sure that we start doing better and not just looking at racism, but really going to the next step of being anti-racist and looking very much at global health's roots in colonialism and how that's had an effect. I've seen the same kind of movement, what Gus was talking about, with women leaders and in global health, and the disparities are there too. I think disparities would be one of the themes that we're going through right now. And Greg Millett was amazing. And one of the things that I liked what he had to say was about how communities need to be central in our response, and how we really need to not only be setting a table and having everybody at the table, but really listening hard and listening to our communities and making sure that we fund grassroots organizations and that we really look at human rights standards and make sure that those things are there. And I actually think that we're ripe for, maybe the world has gotten so bad right now that people are, it's a time for creative new solutions and a time to for some rebirth. And so there is some hope there. And I'm so glad that we got to hear Gus and that we got to hear Greg Millett and so many others, because they're the voices we need to listen to right now.
Yeah, absolutely. This certainly feels like a time of reckoning. Over at the HIV 2020 conference, one of the things that I thoroughly enjoyed was a webinar that went well. Gosh, who knew it was possible to do a webinar without any problems? Well, the Human Rights and Justice Network were able to do that with Edwin Bernard and his team. And they looked really at both positive and negative examples of how the restrictions imposed by COVID have been used either to improve or protect people with HIV or key populations who might be at risk of HIV, or indeed used as a way to persecute them furthermore. And I was in a conversation with Gus Cairns, who's a British activist of who goes way back. I mean, he probably is royalty, and he had some very interesting things to say about decriminalization and HIV. And maybe we could go to that clip. But before we do, Sarah, just a technical question. Are you able to hear the clips, or are they not coming through to you?
I heard some of the clips.
Okay.
Big Ben again.
And Big Ben again. Wow, we are having fun today. Well, look, let's see if we can hear. And of course, we've got Huxley the dog here with us as well on set. So yeah, let's go and see if we can hear Gus Cairns.
But the other alarming development is how some countries are pushing through HIV criminalization measures under the guise of COVID criminalization measures. And really the lesson is that you shouldn't criminalize the transmission of a disease, full stop.
Yeah, now, I thought he had more to say so that I could have a sip of my wine, which, is what I'm going to do. But on a positive note, there were a number of things coming out of AIDS 2020 and the surrounding spotlight that was put on this about how people in the community really are beginning to thrive and benefit from new technologies, new opportunities to use those in a way that improve public health. And I got a chance to speak to Dawn Skelton, who is a case manager at CalPEP, the California Prostitutes Education Project. She's a larger-than-life character, just an incredible community worker. And what she has done in the last few months is basically take her cell phone, get herself on live stream and go around Oakland telling her clients where they can find food banks, where they can go get showers, where they can go get tested. And I asked her, just what had motivated her and what had got her going. And let's see if we can see and hear that clip.
Facebook, once Facebook came up with the live thing, I mean, you can reach way more people, and a lot of people pay more attention. And with the world being shut down like it is, a lot of people don't know. All people are able to do nowadays is just to be on Facebook and stroll down and see what's going on, because a lot of people aren't able to leave. They don't know where to go, scared, and it made sense that if I have some information, the best way to get it out is to go Facebook Live and tell them, like I said, CalPEP is going to be there. If they need anything, don't hesitate to call us and get in touch with us. And there's so many people out there helping and so many things available that people don't know about. So by me going live, I was able to give a lot of people information that they wouldn't have got any other way.
Yeah, she's incredible. Absolutely incredible.
Yeah.
So, Sarah, looking forward now as we are in this new phase of the pandemic, we're in this long haul in the fight against HIV, and given your expertise in different health priorities, what's making you optimistic? What are you going to be looking for in the coming year?
Well, it's really, thanks, Ben. People like Dawn give me hope. The people that are out there in the field and giving care to others gives me hope. But the other piece is that COVID-19 has catalyzed so many rapid adaptations in healthcare, whether you're talking about telemedicine and so many of the acceleration of different ways to communicate, like Facebook Live, and other things that the technology gives me hope. And it's just such an odd time to have the hope of the technology and to see so many wonderful activists really making a difference, and then seeing the inequities at the same time, and it feels like things are getting worse. It's just such a strange and challenging time. But I would say people give me hope, and then a lot of the inventions that people are creating to get through this time for better health care for others is another thing that's given me hope.
I got to say, I think one of the things that's unique about the Bay Area is that it's a small space, but there is so much innovation piled on top of itself. And that's one of the things that really inspires me about the organization that you lead, the Bay Area Global Health Alliance. And again, going back to Dawn, the idea that technology that was made to bring people closer together could be used as well to help them in situations of health need, of health emergency. I think that is terrific. I mean, obviously, I'm really excited about where we go with the vaccine agenda. I've been really pleased that people like my former boss, Peter Piot, have been, trying to put the brakes on the enthusiasm. We're unlikely to have a practical working vaccine by the fall. But it is really interesting to see how the world has really mobilized. And it's an opportunity to put public health at the top of the agenda. One colleague that I spoke to, Christine Stegling, who is at Frontline HIV, Frontline AIDS, was also very excited in the way that human rights is going to be pushing the biomedical agenda. And, we've got a new executive director of UNAIDS in Winnie Bianmani. And, and Christine said that the best thing that she'd done and had heard was for Winnie to say that human rights have to be the driver for these new innovations, these new technologies. And I think another thing that really always at these conferences inspires me is the leadership and the story of people at the front line, just as you mentioned. And I had a chance to talk to Erica Reyes, who was a project manager at the Trans Thrive program at the San Francisco Community Health Center. And she has a wonderful story about how she picked herself up and, not only as a client, but then came into to work for the agency. And it's worth just hearing her if we can.
So I was a client with them for 16 years. I'm living with HIV. I mean, I was diagnosed with HIV in 1999 and was originally getting my care in Highland in the East Bay and transferred to San Francisco and stayed with the agency and was a peer leader. And, I worked closely with Nikki, Tita Ida, with whatever projects that she had for her ATE. At the time was called the ATE program, which is for Asian Pacific Islander trans women. And so I was a volunteer here for like 4.5 years. And now I'm an employee here. It was always my dream to work here. I always kind of looked up to the ladies that worked in the trans department here throughout the years. And so for me, it's just really been a 365-degree life experience for me. And I'm just really happy to be here and to be a part of it now.
Incredible, amazing woman. And I know the San Francisco Community Health Center is a member of the Bay Area Health Alliance. So there's so much there, I think. So any other lessons that you've picked up during this crazy week?
It has been a crazy week, Ben. I think the other thing is just the importance of delivery. You were talking a little bit about the vaccine, and I think it was Mitchell Warren that was talking about the importance of delivery, and other people were talking about it as well. You can come up with some wonderful science, but unless you figure out how to make it community-based, how to make it human-centric and appropriate for, the end user, and figure out your supply systems and everything else, it doesn't work. But what's really exciting is that we have most of those players just even here in this one region that we can really work on together to figure out how do we deliver healthcare in a more equitable way to everyone.
Yeah, I think that's right. I mean, it's sort of an opportune, perfect moment that an institution like the Bay Area Global Health Alliance has come into being with these various sectors: health, biotech, nonprofit, academic.
Mm-hmm.
And there really is a need to invigorate the vaccine preparedness and literacy. And let's not forget that just at the north of our area, we have Marin County, which is the heart of the anti-vaxxers. So we have a unique opportunity to help prepare the field for vaccine preparedness. So yes, I'm sure that's something we'll be hearing much more about. So with that, I guess, Sarah, we have sort of survived our first live stream with clips added, and congratulations to you. And I want to see if you've got your glass of wine there, which I think we're actually drinking the same wine. This is
We are.
a very BBC thing to do. But cheers to you, and good luck with the Bay Area Global Health Alliance. We're very grateful for your support here at A Shot in the Arm podcast. And there's a lot of work for us to be doing, hey?
There certainly is. And same to you. Cheers to you, Ben, and for your commitment to this community for decades, and to all of our board members and our members. I'm honored and humbled to be working with them, and we definitely have our work cut out for us. Cheers.
Oh, we do. Cheers. Well, I think instead of me closing this session out, I think we should go back to Dawn Skelton, who at the end of my interview with her had some really interesting words to say of hope. And I think that's a wonderful way for us to end up with this particular show.
Okay, so let me leave a message before I go to everybody that who's chiming in. If you don't do nothing else, help somebody. I don't care what it might be, whether it's giving them some information, whether it's feeding them or giving them some clothes or a blanket. Help somebody without expecting nothing in return. And I promise you, you are going to feel so good. And that good feeling of how you keep doing it over and over again. So help somebody, be a nice person, don't hate, and just love on one another, okay? The world's going to get better. It's going to get better. And it's going to open back up, too.
Right. Well, that's it for this episode. Thank you all very much. Thank you, Sarah. And of course, everybody, don't forget to wear your mask.